Good morning. Thank you for so much for joining us this morning. I know it's a little bit chilly, but it's a beautiful, beautiful morning for what we're doing today. I'm Teresa Singleton. I'm the Foundation Manager for the Delta Dental of Oklahoma Oral Health Foundation. We're thrilled to have you here today as we introduce our new delivery, as you see back here. That's what we'll be talking about today. It's been my pleasure to serve the foundation since 2009, and since that time I've been associated with the mobile dental care program and seen how far it comes. Our foundation's mission is to facilitate dental health and education by funding programs just like this. And now we've expanded into even more of a hands-on partnership approach, and I'm just thrilled to be working with the ODF at this level. This year our foundation is 15 years old. We're so excited about that. And by the end of this year, Delta Dental will have contributed over $10 million through its foundation to programs just like this. We want to take a moment to highlight the stars of this program, and that is our volunteer dental professionals. This program would not have a fraction of its reach without their help. And joining us today is Dr. Phoebe Brown. She practices dentistry in Edmond at Griffin Smiles. Dr. Brown began volunteering with the program in 2011 as a fourth-year dental student at the University of Oklahoma College of Dentistry. She was then accepted into the AEGD, that's the Advanced Education in General Dentistry program at OU, and as a resident continued to serve with the program. Since graduating from that program, she has continued to work on the mobile unit in metro areas, mostly at schools and missions. One of her favorite sites is the Baptist Mission at Stockyard City in Oklahoma City, and she's also been a longtime DDEN volunteer. Dr. Brown?
I'm going to say it again. We have all been given a gift to help others. And I'm privileged because I have the gift of dentistry. I can get people out of pain, and I can also set them up for success for oral health in the future. There are many, many volunteer opportunities for dentists to participate in, and the mobile unit is one of my very favorite because you can give access to care to people that won't normally be able to go to the dentist and have that. I've been to different missions, like you said, Baptist Mission, and different schools. The schools are some of my favorite places to go because a lot of children, although they have assistance from the government, can get care. A lot of them are not ever able to go to the dentist for different reasons. And so we're able to provide that to get them out of pain and also set them up for success in the future. So I'm excited about partnership with Delta Dental too because they have the same like mind and passion for dentistry, for helping people, and for making Oklahoma a success in the oral health realm. Thank you very much.
Every single day, thousands of Oklahomans and their children wake up in dental pain, and they face barriers to get the dental care that they need. And cost, of course, is a very big barrier for the uninsured and the unemployed and those that are on fixed incomes. Opportunity cost, such as lost wages, can prevent low-income individuals from accessing even free and low-cost care. They can't take an afternoon off to go to the dentist when they're getting paid by the hour. They have things to take care of. And in some rural areas, Oklahomans have to travel over an hour just to access dental care. And even though that's the case, transportation can still be a barrier, even in urban settings where you may have a dentist on every corner. It's still an issue. So eliminating these barriers to care are what we're all here about today. The Delta Dental of Oklahoma Oral Health Foundation has supported the Oklahoma Dental Foundation's mobile dental care program since its inception in 2006. And now we are very proud to formally partner with the ODM to take this program to the next level as the MobileSmiles Oklahoma program. Now, this partnership combines the resources and experiences of our two foundations. It strengthens our ability to eliminate barriers to oral health in Oklahoma. Now, the ODF will continue to contribute its greatest resources, volunteer dental professionals, without whom this program would only have a fraction of its reach. The Delta Dental of Oklahoma will provide a bedrock of funding by pledging almost $1 million over the next 4 years. Now, the leadership of both organizations will work together to make MobileSmiles Oklahoma the premier volunteer-driven mobile dental program in the nation. So we're here to also launch Mobile Unit 2, which effectively doubles our capacity to impact the oral health of all Oklahomans. But For this program to reach its potential, we still need your help in 3 ways. First, volunteers. If you're out there and you're a dental professional, your time and skills are vital for this program. Without volunteer dental professionals, this program is over. 2, donate. While Delta Dental funding covers almost half of the expenses of this program's annual budget, the financial support by other foundations, corporations, and individuals is absolutely necessary. And 3, and probably even more importantly, is to have the willingness to serve as a site partner and to bring the MobileSmiles van to your community. So together, we will all deliver education and care throughout our state.
It's a true pleasure to be with you this morning and to see so many friendly and happy faces. Faces that have been devoted to helping the oral health of Oklahoma for so many years. It's incredible to see folks like D-Dent and the folks at the university and so many others who have been here for all of these years saying there's a problem and there needs to be a way for us to reach out to help Oklahomans who really need oral health care. And the answer has been right here under our noses for so long that many of us didn't recognize it. And that is that we are able to utilize the volunteer care of dentists across the state, the power of both the membership of the ODA and those who are contributing to the ODF, and the financial resources of Delta Dental to be able to make all of this occur. We are truly blessed to be able to be here today, to be able to launch this second unit. And why? Because so many times we would have to tell a place we're just not able to come out because we don't have the manpower to do it. So many times we have been to a town and we say we need to go there, but we need to go there for a longer period of time. We need days and days to be able to help a school where there are 1,000 children who are in need of oral health care. This allows us to be able to open doors that have been closed to us before. In order to overcome those barriers that John addressed, we believe that this second mobile unit is going to be critical. And so we are very excited to be able to launch them. Perhaps even more importantly is the partnership that John addressed. As a not-for-profit, obviously we are searching for funds every day. A big part of my day is focused on asking who can help us today. How are we going to be able to reach out to one more foundation, to one more company, to one more individual who will allow us the power to be able to go out to help one more person? By knowing that we have support from Delta Dental over the next 4 years, that we have the help and work of Teresa Singleton, we are absolutely confident that we do have that bedrock on which to build. It's so exciting because just a year ago, we actually were having a board meeting with the Oklahoma Dental Foundation Board, and we had just suffered a catastrophic disaster. That catastrophic disaster was that coming back from one of the sites, the engine blew out on our original mobile dental unit. That put us out of commission for several weeks. We had to cancel sites where we had people who were expecting us to show up, kids who needed care, adults who were not going to get dental care if we weren't there, overcoming those barriers. And so we sat in a board meeting and we said, oh, this is not good. We can't allow this to happen. And so our board decided a year ago that we needed a new mobile dental unit. And so they authorized us to begin the process of making that happen. And so today we're able to see the fruits of that labor in just 1 year. What we've been able to accomplish in research, in helping to design this unit, and now being able to announce it in the way that we are today. And so we're grateful to Delta Dental for their partnership, for their long-lasting vision to be able to see what this could become. We're so grateful for the board of the Oklahoma Dental Foundation, for the trust that they put in our staff and their ability to help vision what this could be like. And all of the members of the Oklahoma Dental Association, we are so grateful for their commitment to making certain that oral health care is a reality for all Oklahomans.
For us to really make the program expand the way we wanted it to, we needed a new unit, and they're happy about it. We needed a new unit, and here's our new unit, and the only way this would have occurred is if we had partnered with Delta Dental. Delta Dental has been very, very outreaching to us and funding us, and we can't say enough about what they have done to help us. And the dentists out there in Oklahoma, I would repeat what Dr. Brown said, we need volunteers. A lot of dentists have stepped up to volunteer. Our goal at the foundation is to eliminate barriers for dentistry for people in Oklahoma. And that's what we want to do. And I'm just here today to say thank you for all of you that came. And I know this is going to be a very successful partnership.